Is that better? I kind of switched the microphone around. Let me know if that's better. Okay. All right. We're going to go away with a fancy microphone and go with the computer microphone. So, okay. Basically, everyone, I'm trying to teach you a little bit about sports groins and sports hernias because I was stressed out through most of World Cup because I was hoping that no one gets injured. I for sure saw so many people have injuries, mostly of the shin and the ankles. In general, soccer is like really fun to watch. But I think it's one of the worst for your bodies because you're banging your head on the soccer ball. So your head can get concussed. We saw multiple concussions and people being taken off the field, and a couple were not allowed to play for a couple days, I think, because the concussions were so bad. You're compressing your spine when you're doing these headbutts with the ball, and then you're running around. A lot of lower abdominal strength is necessary. You do a lot of adduction, kicking, fast movements, moving forward, backwards, a lot of kind of explosive movements and motions. And then, man, the ankle, the amount of pressure and tension on those little ankles and knees. There were a couple ACL injuries. I think there was a hip injury, and there were definitely some groin injuries, and some actually male-like kind of testicular injuries. Mostly painful, no actual need for surgery for those. So I thought it'd be good to kind of review sports hernias, given that there was so much talk and discussion about these sports injuries during the World Cup, and help dispel some myths and rumors and so on. So in addition, many of you have submitted questions related to sports hernias, which I will definitely review. We have about 12 or 15 questions. But in addition, I have a couple questions that were submitted unrelated. So I'm happy to answer other questions while we're here for the hour. So let's just review what a sports hernia is. So by definition, a sports hernia is a hernia is an injury. It shouldn't really be called sports hernia. It's really called sports hernia because all the other medical terms are too medical. So people have just decided to call it sports hernia because it's easier to talk about sports hernias. But it's really a sports injury that's related to the core muscles. And your core includes your abdominal wall, your flank, your back muscles, your pelvic muscles, your muscles that hook up to your pelvis, which include your hip and your adductor muscles in the front, and then your diaphragm. So, and your chest wall. So injuries to all of those can occur and will have implications for someone like me who does abdominal wall and pelvic wall surgery. Fortunately, most of these injuries do not need surgery, but they come with different names, and the names are all related to kind of where the interest is in terms of where the injury is. So, for example, I like to call it sports injury or groin strain. I think if I use the term groin pull or groin strain, people understand that. I always talk about LeBron James because I'm a huge basketball fan. Our family is a huge Lakers fans. We literally like have so many Lakers outfits to wear every day. And so LeBron James is like very dear to us as a current major player on the Lakers, and he suffers from bad groin strain, and it's a recurring problem for him. So I prefer to call that groin strain than a sports hernia, although I haven't personally examined him, and I would love to. So if any of you know LeBron James out there, please tell him to call me so I can examine him and make sure there's no missed hernia, but it sounds like what he has is a groin strain. Other terms for these problems are sportsman's hernias, groin plate disruption, groin disruption, Gilmore's hernia, micro tears, core muscle injury, adductor tendonitis, osteitis pubis, iliopsoas tendonitis, psoas syndrome. There's all these different local areas where there's injuries. The basic concept is there's muscle and the muscle tears. Now, it's really hard to tear muscle, first of all. So you should not just walk around and have a random muscle tear. That doesn't usually occur. And usually it occurs in athletic muscles. And the reason why I say that, at least the ones that I'm dealing with, and it doesn't sound right. Like, aren't you an athlete? Shouldn't you have like really strong muscles? And then why would that tear? Well, the reason is your body is like a pulley system. You may have heard this by other people before. So it's like a pulley system. And for every action, there's an equal and opposite reaction in terms of balancing this pulley. So, for example, if you ever had like a cramp in your leg, that's a spasm of a muscle. Well, it's really hard to walk actually, because your other muscles are trying to compensate for the fact that you're missing the ability to contract and use that cramped muscle. And the same is true for sports injuries. So as you know, muscles have to attach to something, right? And usually they attach to bones or ligaments. And muscle stretches, right? You can elongate muscles, you can stretch muscles. That's how we stretch out and so on. Bone does not move. Bone is like rock, cement. It doesn't move. It is completely hard and not meant to stretch. So at the interface between where the muscle or ligament which can stretch, attaches to bone, which does not stretch, that area is an area of tension. So what's a good analogy for that? It's like a purse, when you have like a buckle and you attach the buckle to like a strap of a purse, that area where the strap and the buckle kind of connect, that metal buckle will not tear, but the strap may tear. And you've seen people who have either luggage or purses that tear. It always tears at an indirect intersection between something that doesn't tear, like the metal buckle, and like the leather handle or something like that. So when you have, let's take a hockey player. So the top sports injuries are soccer and hockey, football, American football, rugby. So those are the top. We don't see swimmers or cyclists, having these type of injuries. A little bit in tennis is possible. You can have a groin strain, and I'll explain to you why we don't see it as much. Maybe a little bit in basketball, and I'll explain to you why certain athletes have it in basketball and others don't. So part of the problem with soccer and football and hockey is you're dealing with people with really, really huge, super strong muscles. So they have these enormous muscles, like a hockey player. If you've ever seen a hockey player, and I've treated many of them, these NHL, their thighs are humongous. When I put them on the operating room, their thighs are so huge. I mean, it's pretty amazing. When you put them on these narrow operating rooms, their thighs are so huge that the legs can't come close together because there's so much muscle in between their legs, and their legs are kind of like splayed open a little bit, and the thighs will be wider than the bed. That's how thick some of these hockey players' thighs are, and they have to because of the type of sprints they do as part of their sports. Same with soccer, except with soccer they do a lot more cardio, so they tend to be a little bit slimmer than the hockey players, because they're constantly running along this really huge, they're more like long distance runners, but they also sprint. So if you have these enormous muscles that are attached to bone, the bone doesn't change size. If you're a huge guy, your bone is the same size as when you didn't have those muscles, those huge muscles. So the muscles overgrow and they remain attached in the same manner as when the muscles were normal. And that interface between the muscle and the bone is very sensitive. So one issue is the players are not stretching enough. The whole issue with stretching, like, oh, you should stretch so you don't have any injuries. Stretch so you don't get an injury. Well, that's why. If you stretch those muscles, you are elongating the muscles. You're allowing to literally stretch. Otherwise, it becomes cramped and tight. If you've ever been on a long flight and you've been sitting down, or you take an exam, like a 4-hour exam, you've been sitting down and not moving, you can tell that when you want to get up to stretch, it's a little tight. You're a little tight, and you're trying to stretch things and bring them back towards normal. So the purpose of stretching before fully engaging in sports is to literally stretch and elongate those muscles. And therefore, the tension between the muscle and the bone in that interaction, in that interface, is reduced. So you're making it so it's not as tense, and it's not as tense there. So then when you're doing sports and you're contracting those enormous muscles, they're contracting without tearing off of where they're attached. And that's what a sports injury or sports hernia, sportsman's hernia, Gilmore's hernia, core muscle injury, what all these are, it's a tear, usually between the muscle and where it attaches, which is the bone, or a consequence of that tear. And these are usually micro tears. So it's not like a full-on disruption of the muscle. It's a micro tear. Like if I took an axe and I cut the guy's leg off, that's a full disruption. That's not what happens. You don't actually tear fully. It's these micro tears within the fibers. So if you think of the muscle as like clothing, like a knit sweater, it's the fraying. Or if you think of it like a pair of jeans where you get the fraying, it's like in style now, but the fraying of the fibers of jeans are kind of what happens also to your muscle. You can also have tendon tears, like Achilles tendon tears. You can have iliopsoas tendon tears. So it's not always a muscle tear, but specifically for our purposes of discussion, we're going to talk about the muscle tears. Otherwise, it's really an orthopedic issue when it's a full tendon disruption or tendon tear. So the micro tears can cause pain. So if you have a micro tear of the muscle, it's going to be painful every time you contract the muscle because it's torn a little bit, and now you're pulling on these torn, frayed muscle edges. So that's where you just get pain with activity. It's not surgical. You just have to allow those micro tears to heal. That's where we say, okay, rest it. Don't overuse the muscle. Allow it to basically scar in that area and heal in the area for healing. So that's where most of us say, yeah, you have a sports injury, a groin strain, etc. No need for surgery. Now, if you're LeBron James or like playing in the World Cup and you have a groin strain, it's going to affect your ability to perform at the level that you're used to performing. Because if you're in that much pain, you're not going to be able to run as fast or jump as high and so on. And therefore, for professional athletes, the treatment algorithm is very different than for the average athlete, let's say a high school, college player, or like someone who plays on the weekends and so on, and otherwise has like a day job. So for people like professional athletes, World Cup player, they are not told to rest because they can't rest because they have a full game to play, or the playoffs, or the World Cup, etc. So they are artificially expedited in the healing stage. So the normal person, not professional, they just are told, rest it out. Your body will heal these micro tears. It'll go back to normal. And in that process, it will scar in a little bit. And then you'll do some physical therapy to break up some of that scar once it's laid down, and everything will heal itself, and we'll just work on reducing your risk of this happening again. However, for an athlete, they skip through all of that because their living is, and their ability to function is based on their career, and they are expedited straight to maximizing the healing of that, rapidly reducing the inflammation in that area. They often go straight to MRI the minute they get this snap or pain or whatever. They go straight to MRI to assess the problem. There's a doctor back there that injects the area with steroids. Steroids are very strong local anti-inflammatory. They're probably given some pills to take by mouth as well, or a shot. Many of them get a shot of intramuscularly in their arm, for example, of anti-inflammatories, and they're told to go right back in there. And that temporarily gets rid of their pain and helps heal that area while they're continuing to abuse and overuse that muscle. And the reason why a lot of these players get it, whether it's soccer or football or basketball, is because many of them have inordinately large muscles, and it's not balanced with equally large muscles on the opposite side. So quads versus hamstrings, adductors versus abductors. The whole body, like I said, is a pulley system. So it's very important that an athlete strengthens their muscles equally. Same way where your back and your front, your core, like I mentioned, includes your abdominal muscles and your back muscles. So if you have back issues, they will have you work on core abdominal muscle strengthening and have you do planks and sit-ups and different transverse abdominis muscle and rectus abdominis muscle exercises, even though your issue is your back, because a strong core in the front will support the back. The same is true for your thigh. Strong hamstrings support and balance strong quadriceps tendons, and vice versa. So strong abductors will help balance the adductor muscles. So if you overuse or overdevelop one part of your muscles to the detriment of the other, you're at higher risk for injury, especially if you're a professional athlete. And that's sometimes what we see happens, which is why physical therapy is part of the prevention. Because physical therapists are well aware about this pulley system and this ability to balance different muscle groups against each other. And in addition, physical therapists kick in once there is an injury to lengthen those muscles, work on strengthening the muscles, because the stronger and more fit the patient, the faster their recovery. So that's kind of like a general overview. The different muscles that mostly we talk about are in the groin. So they are attachments of muscles to the groin, fascia to the groin, adductor muscles to the groin, and the rectus muscles are your six-pack to the groin. There are other areas where you can get sports injuries, but we tend to talk about sports injuries as like groin strains. And groin holes. And one of the things that we call it commonly is called athletic pubalgia. So athletic meaning of athletes, and pubalgia means puba means like the pubic bone. Algia means pain, so like pelvic pain, athletic pelvic pain. Oh, okay. First question, just go straight to treatment options. How do you treat a sports hernia via laparoscopic or open surgery? So first of all, most, and by most I mean more than 90% of patients who have true sports hernias do not need surgery. So the first answer is I almost never have to do surgery on these patients. And then the question is, okay, do you do it laparoscopically or open? And I know there's other questions coming up. So I'll tell you, it depends on the type of injury. So is it an anterior injury or posterior injury? Does it need anterior or posterior support? Does it need anterior or posterior reconstruction? Are the nerves involved? And all of that will fall into the category of whether you should have an operation performed laparoscopically or by open manner. This is a question, I'm going to come back to this question later because it's unrelated to sports hernias. Okay, so here's another question that was submitted with you all. Are there specific exercises that help athletes in general, especially those in high-risk sports? So yes, good physical. So then in general, you may know that many athletes have returned to Pilates and yoga because they've understood that it's not just important to build muscle, but it's also important to elongate those muscles. Pilates is a fantastic way to elongate muscles and reduce injury. When you go see a physical therapist, much of what they do for you is based on Pilates type methods. Yoga is kind of more difficult, I think, to adopt for everyone. You need to be a little bit more limber with yoga. And if you're not, you can injure yourself. So be careful with yoga. I'm not limber, which is why I'm a big fan of Pilates, but Pilates and physical therapy. So part of the preventative prevention of sports injuries, sports hernias, is to strengthen muscles and prevent them to be at risk for tear. And then the other part is to help elongate it. And then there's a whole balance. So the strengthening is also strengthening of anterior and posterior muscles, for example. Are there any kinds of exercises that can reduce lifetime risk of getting an inguinal hernia? So this is specifically about inguinal hernia as opposed to sports hernias. So we believe that all exercises are good and help reduce risk of inguinal hernia and ventral hernias because it maintains your weight. We know obesity, as we discussed last week, obesity is a high risk factor for any hernia. Exercise helps maintain your muscle strength. And we know that the stronger and more fit the patient, the less likely that they will get injuries. And if they do get injuries, the faster they will recover. And we also know that in general, from an inguinal hernia standpoint, we don't see athletes get hernias. If you look at patients who are regular exercises versus those who are not, all the studies show, both in men and in women actually, that those who perform some sort of exercise on a daily basis are significantly less likely to have a hernia or present with a hernia than those that do not. So any type of muscle strengthening and exercise in general is considered healthy and safe for hernias and potentially protective of hernias. However, we do know from an old study, I think from 2006, that where they took medical students and they measured their abdominal pressure as they were doing different exercises, and they found that the exercise that we thought were bad were actually totally fine. So sit-ups, planks, weightlifting, deadlifts, overhead lifts, pull-ups, those all involved engagement of the abdominal muscles and did not increase abdominal pressure, and therefore we felt they did not increase risk of any hernias, especially inguinal hernias. However, two specific exercises, one was jumping and the other one was squats. Those did cause a significant increase in abdominal pressure. And usually when I talk to patients, especially if I feel like they will be doing jumping or squats, or they like CrossFit, let's say, I do tell them to look for different ways of doing similar exercises. So if you're thinking of doing, let's say, squats because you're looking on improving your kind of gluteal muscles, there are other ways of working on the glutes without doing squats, especially if you're prone to hernias or you're worried about hernias or you have a hernia. So that's where it is. I'm really excited. In the next year or two, we should have new data, especially out of Europe, where they have specifically gone through even wider range of exercises with much more detail, and are measuring abdominal pressures, and hopefully we'll have a little bit more clarity as to what exercises are good and what are not in terms of prevention for hernias. So I hope that was a kind of long answer for a short question. What physical activities should be limited if you want to minimize your risk of a sports hernia? Okay, so now we're talking about sports hernia specifically, not inguinal hernia. The activities that minimize rapid movements, twisting movements, kicking in particular, explosive motions, cutting, we often call it cutting. Those activities put the most strain on the interaction between the muscle and the bone, and therefore give you the highest risk of having some type of groin disruption. I would say that my recommendation is, if you really want to prevent it, do low impact exercises. That could include cycling or swimming. Those are really, really great and very, very low risk of having any groin disruption in terms of sports, at least. Given that sports hernias mostly occur in athletes who have good tissue quality, why do they not always heal on their own? Great question. Especially with rest, physical therapy, and conservative measures. Great question. So it alludes to the fact that a lot of these athletes with, quote, good tissue quality, first of all, no one knows that they actually have good tissue quality. They have strong, they have developed muscles, but whether the collagen within those tissues is normal, we don't know. That has to do with your family history. Some athletes are very hyperflexible. That's not really good for sports. You want to have very stable joints. So I assume maybe some of them actually don't end up doing a lot of sports because they're hyperflexible. Many are hyperflexible at the joints, which implies a collagen kind of mismatch and disorder. And once they're stronger, then they're actually less flexible, and that's good because they'll probably be normal. And I just had a patient this week, excuse me. So she was a marathon runner, but she said when she was younger, she had very floppy hips and knees. So she would like sit down like, I don't know how to explain it, but with the kind of knees in, but the legs out and the hips inwardly rotated when she was a kid. But then she started running, and that strengthened the hip girdle and the muscles and joints and ligaments around the joints in her knee, and she became less flexible. I would say less hyperflexible and more normal flexible. So that's one thing. Live question. I have surgery last week. Oh, you had surgery last week. Okay, great. Open surgery, right? Inguinal hernia, great. Can I come back in ball sports? So ball sports depends on the ball sport and depends on the surgery you had. So obviously I would defer to your surgeon because you're fresh after surgery, because they know what kind of hernia you had and what type of repair that was performed and what your kind of lifestyle and risk factors are. However, in general, if you've had a laparoscopic repair, I usually don't restrict any sports after surgery. I've had patients that cycle 50 miles the next day. They travel, they run, they play volleyball. So I'm totally okay with that. Open repair with mesh. If it was not a huge hernia and you're not worried that there may be a disruption or there's like a less overlap of mesh with tissues, also most likely do not need to have any restrictions and can go ahead and start playing ball in the average risk patient. Tissue repair is a different story. With a tissue repair, you do not have the benefit of mesh buttressing your tissue repair, and you're 100% dependent on your tissue strength and quality and the surgeon's technique to heal. Whereas with mesh, you kind of don't, the mesh takes over a lot of that. So you can have poor technique, poor tissues, and still do well with mesh. Not so with tissue repair. So if you've had a tissue repair with no mesh, then in most of my patients, I give you at least 2 weeks of just walking. You can cycle, but I would not do anything that has a risk of disrupting the groin or adding pressure in the area. The same way I don't want you coughing and sneezing and so on. All right, here's another question. Is numbness 4 months after an open inguinal hernia repair with mesh normal? Yes. My surgeon said it can last a while. Yes, it can last over a year. I'm wondering if it will ever go away. It may or may not go away. Most early numbness after any hernia, any surgery, I would say, is related to the swelling in the area from the actual surgery. So if you have any swelling in that region compared to the rest of your body and you're numb, much of the numbness is related directly to the swelling. If there was any nerve cut, that would be a permanent numbing of the skin. And cutting the skin does cause numbness right where you cut the skin, but those all go away after many years, and you should kind of regain your sensation in the area from those specific ones. The surgery seems to have gone well, otherwise great. And I'm exercising again and feeling better and losing some weight too. Perfect, which I need to do. Excellent. We talked about this last week, how important it is to actually lose the weight before the surgery, not after, but anything is good. The numbness is a few inches below the incision site, like right at the top of my groin, at the top of my leg and bottom of my groin. Yeah, that's fine. That's probably from swelling from the surgery. Because we are, how should I explain this? Upright human beings, then any surgery you have will have swelling, but the swelling will be pulled down by gravity. So since you're upright, you're going to have swelling a little bit lower than your incision, just because any of the fluid eventually will gather down towards the groin area. All right, next question. Can you safely suture muscle as some surgeons do in their sports hernia operations, going against surgical dogma? So the muscle that's sewn is often the tendinous part of the muscle, or it's scarred muscle. So normal muscle is not easily sewn. You kind of need to either sew it because it's scarred, or you sew it in the tendinous portion of the muscle. You're right. Muscle itself it's like filet mignon. It's very delicate. Given how close the superficial ring is to the pubic bone, can the symptoms of sports hernia overlap with standard inguinal hernia? Yes and no. Often no, because the type of pain and the way it radiates and the fact that a hernia actually has a hole, whereas a sports hernia technically is not a hernia, does not have a hole, all of those make it so that sports hernias are often painful with engagement of the abdominal wall, twisting of the abdominal wall, whereas inguinal hernias are not only painful with activity, but more so with any increase in abdominal pressure, such as a cough or bending. It's actually, the pubic bone is not very close to the superficial internal, is not close to the internal ring. That is not an accurate statement. It's fairly far away. And so you should be able to differentiate in most patients the difference between an actual inguinal hernia and a sports hernia. All right. Hope that was well answered for you. Next question. Can a sports hernia be present with only subtle signs on the MRI, i.e. not overt signs? So yes, it depends on the degree of injury. If you have a massive injury, which is limiting you in the ability to function, that should be identifiable on MRI as swelling in the area, fluid collection, edema, and in the acute phase and in the chronic phase as scarring in the region. However, in patients that just have like a small strain, where let's say they were playing baseball or soccer, because now it's cool to play soccer because everyone's watching World Cup. All right, I'm now 45 years old and I'm going to go play soccer, and I haven't been playing sports for a while, and I'm not going to stretch, and you get a sport groin strain. Something like that most likely will not show up on an MRI because it's a much more lower grade strain. It's truly a micro tear that's not extensive. Your muscle's probably not huge, and therefore the distribution of the amount of injury will not be much. And simple rest and anti-inflammatories alone should be adequate to address that without need for imaging. Can you describe the differences between Gilmore groin and athletic pubalgia? Okay, it's basically the same thing. So Gilmore groin is very specifically a disruption in the groin or inguinal floor. So as opposed to athletic pubalgia, which can be interpreted as many things, and it can include adductor tendonitis and rectus abdominis tears, as well as tears in the groin. My understanding is when people talk about Gilmore groin, they're usually British. Dr. Jerry Gilmore was a British surgeon that figured this out in many soccer players at the time. I think in the 1980s. We don't usually use the term Gilmore groin as much in the United States. And then usually when people are talking about Gilmore groin, they're talking about the actual groin. So I think there's going to be a question coming up, which will help. Here it is. When do sports hernias require surgery? So we talked about the algorithm, which is rest, anti-inflammatories, ice packs, Advil, Aleve, ibuprofen, and so on. And then activity, which includes walking, low risk, low impact activities, things that don't overdo the area, because you don't want the scar tissue to then contract everything. And then if that works, great. If it doesn't, then you're going to need to do some injections into the area for pain control and to reduce swelling. If that doesn't work, then you do more injections and consider adding what's called PRP, which is a plasma-rich protein, which you basically take your own blood and spin it down into a rich concentration of proteins, and then re-inject that into the space to encourage healing in the area. And then if that still doesn't work and the patient is debilitated, then they do surgery. And the surgery needs to be very, very specifically tailored to the patient's need. So an inguinal hernia repair is not going to fix a sports hernia because there's no hernia. Adding mesh isn't necessarily going to address any sports tear, because often mesh adds more inflammation, and there's no need for that kind of support or addition of something that doesn't stretch, similar to the bone, unlike muscle, and something that can potentially add injury. So the type of surgery has to be very specifically tailored to the need of the patient, the type of injury that was done. And then one of the questions I think is coming up, let's see, or maybe I answered it already. Here it is. How do treatment options differ based on the type of injury? So let's only talk about surgical options, because I already reviewed the algorithm before surgery, and I also mentioned to you over 90% of patients do not need surgery. So let's say you're down to the need for surgery. Let's figure out what the problem is. So if I do laparoscopic, so if I think it's a hernia, like an actual hernia, then I do hernia surgery. And that's often done laparoscopically with mesh for these big, burly patients, and they do very, very well. But if I had a ballerina or someone smaller build, I'm not going to do laparoscopic with mesh. I would do tissue repair. However, it's possible that patients don't have hernias, or they have let's say they do have a hernia, because that's common, but what they actually have is a tear, and that tear is best addressed open and not laparoscopic. Why? when you do laparoscopic surgery, you're attacking everything from behind the muscle. You don't see the nerves, you don't see any tears, it's behind the muscle. The tear and the nerves are all in front of the muscle where the fascia is. So that needs open surgery. So you cut right over the groin area, like a finger breadth or two above your groin crease, and you examine the fascia, and the fascia may have a tear in it. And you have to close that tear. That does not need a mesh usually. You just, it's like a tear, let's see, if you had a tear in your jacket or something. It's just like a linear tear, like a fabric tear. So that can be part of the cause of the pain. You just close those with suture. There's a nerve, the ilioinguinal nerve, that runs right underneath that tear commonly. And many of these patients have nerve pain. I am not a fan of cutting that nerve. I know some people go in and just permanently cut that nerve because they feel that the nerve's been injured over time and therefore kind of deserves to be just cut so that the patient is not left with chronic pain. I understand that nerves can regenerate, and in the right patient, I prefer not to cut the nerve, but instead repair the tear above the nerve to prevent the nerve from getting caught in this tear and reproducing this nerve pain, and leave the nerve alone. And I often put like an anti-adhesive to reduce the risk of any scar tissue from involving the nerve further, and may even inject some steroids in the area to help improve the health of the nerve as it's trying to heal. And here's a question: can a patient have both a hernia and a sports hernia? Yes. So this is the common scenario. It is much more common to have a true hernia, an inguinal hernia, than to have a sports injury or a sports hernia. Especially if you're not an athlete, you're not going to get a sports hernia. I have patients out there, you know who you are, who are definitely not athletes, and they've been labeled as having a sports hernia, and yet what they have is an actual hernia. But let's say you are an athlete and you did truly have a sports injury. You can also have a hernia. So you get imaging, let's say, and they're like, oh, here's your hernia. Some surgeons will just be all focused on the hernia because that's a easy for them to repair, and forget that they need to actually address the patient's symptoms, which are not from the hernia, but are from the sports injury. So like the sports tear. So for example, I have seen people that have hernias, but they have a true tear, like I mentioned earlier. It's the external oblique aponeurosis tear with the nerve exposed underneath it. That tear can only be addressed open, but they have a hernia, so they're like, oh, we'll do this laparoscopically or nowadays robotically, and they fix the hernia and their symptoms are not better. Why? Because they miss the fact that there's a sports injury and sports hernia that needs to be addressed. Are you curious what it looks like in there when you operate an athlete? I'll tell you. I've operated on NFL, I've done NHL, NBA. Now I've operated on several actual professional figure skaters. So these people are constantly pulling and tearing and damaging their body everywhere. All their joints, all their ligaments, all their muscles, they're falling, they're jumping, they're crashing into each other, they're doing splits, they're cutting in and out, they're inflamed, and all that inflammation from their injury scars. So you go inside some of these patients laparoscopically, and their tissue is not normal. There is so much scar tissue where there shouldn't be, right behind the muscles, and involving so much stuff that I physically remove some of that scar tissue as part of their surgically addressing their pelvic pain, and it helps a lot. But it is impressive how much scar tissue there is in the abdominal wall and the peritoneum, in the interaction between those two and against the bone. Some of these athletes have such huge amount of muscles, and they damage it so much. The muscles constantly pulling at its attachment to the bone, and you get these spicules of bone, kind of like teeth that are growing, and it's inflamed, it's painful. It's quite impressive, I must say. Have you ever seen non-athlete develop sports hernia? No. From a gluteal bridge? No. And if you have, how'd you treat it? It doesn't happen. I just want to tell you that out there. It's just not a thing. Let's see. How much does your risk of getting a true inguinal hernia increase if you've had a sportsman's hernia? That's a good question. I don't know. I would have to do some research to see if anyone's actually done a correlation of like all the sports hernias they've seen, and then how many of those patients also had inguinal hernias, because we do know that people who are athletic are less likely to have natural hernias. But genetically, if you're predisposed to it, and you're athletic, you're probably delaying your presentation of a hernia. But as far as we know, those two are not related. Inguinal hernias are truly a collagen disorder. They're genetic in nature. Sportsman hernias are due to trauma and tension and disparities in muscle strength, and are not really related to collagen. So I'm going to say no, there is no risk of getting a true inguinal hernia. No increased risk of getting a hernia if you've had a sportsman's hernia. I'm going to stand by that, and if anyone has any that is support it, I would love to see it. How do you minimize the risk of recurrence when treating a sportsman's hernia? Great question. So, let's see. The problem with a sportsman hernia is once you've torn it, you're likely to tear it again. It's the same with like if you have a jacket that's torn and you fix it, the chance of it falling apart at the right area, same area is the same. Same with like jeans. Wherever it tears, that's the beginning of a tear, it'll continue to tear at that area. So in order to minimize the risk of recurrence, you have to stretch a lot, do a lot of muscle lengthening procedures, and really work with your therapist to balance out your muscles so that you don't have disparities in pulling within that system, that pulley system. Have you ever had to remove sutures in the periosteum? Yes. Say from a Lichtenstein repair that was attached to the pubic periosteum. Yes, that's part of if you need to do any type of mesh removal or suture removal. Yes, so we do that commonly as part of an open mesh removal or suture removal procedure. How do you decide when to use mesh in treating sports hernias? Good question. I almost never use mesh for sports hernias. I don't feel, so let me rephrase that. Synthetic mesh. Every so often there are patients, like I had a soccer player from, I think he was from Romania. He's from Romania. He had a true inguinal hernia, but he also had a sportsman's hernia. So I had to address both because he needed a tissue repair, but I didn't want, let me rephrase this. I wanted to give him a tissue repair because he's an athlete, but because he was a soccer player, he was at risk of disrupting a tissue repair for the hernia part because he's already had a sports injury in that area that needed to be closed. So I used kind of biologic mesh in there. So he did get a tissue repair, but I used the biologic mesh to buttress, actually hybrid mesh to buttress that repair for like a year until he's better healed. So that kind of helped. Okay. So let's see. Any more questions? Can mesh use affect an athlete's long-term performance? Not necessarily. So I've operated on several NBA players because, I love basketball. So I love my basketball players and I understand them. And they've all had mesh placed. And the purpose of the mesh was to allow them to get a very quick recovery, go back to playing, and so on. And these are people that have won multiple NBA the playoffs. They won the NBA playoffs. So in All-Star games, and they've been in the Olympics. So it does not, if you do it correctly, you've picked the right mesh and the right procedure, it should not affect a typical high-end, high-impact athlete. For low impact, like a ballerina, I do not use mesh in them because they need to just remain limber, whereas that limberness is not necessarily part of, like, let's say, a basketball or football player's world. That said, if you've read any news, you know there have been a handful of very prominent athletes whose careers have been ended because they had complications with mesh placement in their groin. These patients all had, as far as I know, open repair with mesh, and I would not offer open repair with mesh to a professional athlete. I think the risk of exactly that happening is too high. Are orthopedic surgeons ever involved in treating sports hernias? Yes, they are. Depends on your surgeon. So if you need an adductor tendon release or an iliopsoas release or a psoas lengthening procedure, any of these things that are involving truly orthopedic operations, I usually operate with an orthopedic surgeon, and I do not like to do those myself. There are certain surgeons that are not orthopedic surgeons that are okay dabbling in doing adductor tendon releases. I don't do that because I feel the orthopedic surgeons know much more in their training about it than I do. There are certain institutes that are really, really good and are very involved. We've had at least one of the surgeons from the Vincera Institute, Dr. Alexander Poor, to go back to the prior sessions we've had to listen to that, where that's almost all they do is related to groin disruptions and core muscle injuries and athletic pubalgia. And they do work with orthopedic surgeons, but a lot of the operations they do themselves as well. So it depends on the situation. I like to collaborate. I like to learn from orthopedic doctors, so I like to work with them together. Have you ever removed just a periosteal suture if it was identified as a cause of pain and not the mesh following a Lichtenstein repair? So yes, I have done that. And in some situations with the Lichtenstein hernia procedure, excuse me, with regard to the Lichtenstein procedure, there are specifically a single knot or suture that's causing the pain. And you just go in there and just remove that one offending one. And it could be the periosteal suture. When and why is the ilioinguinal nerve cut when repairing a sports hernia? So I don't know why. Actually, maybe I do know why. I think the thought is if there's neuralgia and nerve pain, then cutting the nerve will get rid of the nerve pain, even if it's not the nerve problem, because the nerve is injured by being irritated by like a, let's say, a peritoneal, not peritoneal, external oblique tear or something. I kind of discussed this earlier, but I think since nerves can self-repair over time, the more you can push them to self-repair, the better the option than to cut the nerve. So I'm not a big fan of cutting nerves. That's just kind of my thing. Do you believe it's sometimes necessary to attach the pubic plate back to the pubic bone? And if so, can it be done with sutures with anchors? So it depends on the situation. If there truly is a disruption of the ligament to the pubic bone, yes, you have to kind of bring that as part of reconstruction of the whole inguinal canal. But if this is a hernia repair, that's a different story. And again, if you're not an athlete, you're not going to have athletic pubalgia. And that, my friends, is the end of December 2022. Oh my God. So everyone, please take next week off. Have a Merry Christmas. Those of you that start Hanukkah on Sunday, Happy Hanukkah to all you all. Have a very Merry Christmas. I can't wait to start 2023 with you all. It's going to be a great, great new year. I love that you guys are so supportive of this platform, both on HerniaTalk.com and my weekly HerniaTalk live sessions. I love you all. Have a great rest of your end of your year. wishing everyone a much better 2023 than any all prior years. And please go to my YouTube channel at HerniaTalk to watch the rest of this and all prior sessions. I really, really appreciate you, and we'll hope to see you next year. Thanks, everyone.